Hi, my name is Melony Bell. I'm sure many of you don't know what PMAB stands for. I didn't either. But after working for MHMRA for the past 10 years, I know it quite well. PMAB stands for Preventive Management of Aggressive Behavior. There are many modified versions that you'll find online should you search about prevention and management of aggressive behavior. But today I'm going to share with you about my PMAB. First, I will share with you the physical requirements that are required when you are doing preventive management. Secondly, the main principles of PMAB. And in closing, I will show you 2 examples of the type of prevention and type of restraint. Working in a psychiatric facility, some of the physical requirements, you must be able to scoot backwards. You're not scooting backwards just, you're doing your leg like this. So you're moving out of the harm's way. You must be able to pivot side to side, grasp a wrist with either hand, pull with either arm, be able to lift or hold 55 pounds, and be able to lie in a prone position, kneel on either knee, and stand from a kneeling position. Some of the characteristics of PMAB include both employee and patient are protected. PMAB is a registered type of defense that is used at my particular facility. Minimum energy is applied, pain is avoided, and prevention is emphasized. Some of the principles of PMAB. Action, reaction. For every action, there is a reaction. You're going to want to choose your actions carefully to get the desired reaction you want. 0 to 100. You're going to act instantly, but smoothly, using the least amount of energy necessary, and 1 step at a time. You're going to do things 1 step at a time. You're going to follow the order until you can get it exactly right. Responsibilities that you should be aware of. You need to intervene early before the situation gets way out of hand. You're going to use communication first. You don't want to walk into a situation and just start doing a maneuver or trying to take somebody down and not know what's going on. You want to cause the least amount of pain or injury possible should you have to take a person down. You want to do the correct release. If you find that you're in the wrong position, you're able to correct that at that point. If you see that the person is in distress, release them immediately and make no modifications to the procedures that you've been taught. As you can see, the principles of PMAB really apply to our everyday life. For example, if your child, your spouse, or your coworker is in distress, you're going to want to ask them, is something going on? I see that you're upset. Or why are you crying? So PMAB really does apply to our everyday life. We may not think of it in those terms, but it really does. And it's why communication is our first line of defense. You're going to always want to ask and listen to the person to try to determine what's going on. One of our core principles is 0 to 100. We can experience this at any given moment in our facility on the floor. Say, for example, John comes running out of his room. We don't have time to ask John what's going on. Evidently, he's in distress. We're going to have to make a decision. That's your 0 to 100. And for every action, there's a reaction. We may have to block John. We may have to keep him from hurting himself or someone else. Or he may need a medical intervention at this point. 2 of the examples I have chosen for today I would like to share with you is the bear hug restraint. Since you have a handout, those directions, if you will follow them along while I do this procedure. Sandra has volunteered to be my patient. I'm going to walk up to her and just say she's in distress. I need to come up to her with my hands in a protective mode because anytime she could swing back. I'm going to walk up to her, I'm going to press my hands into her forearms. I'm going to bend my head down in case she decides to headbutt me. I'm going to cross her arms, and I'm going to grab each wrist, and then I'm going to pull her in to my body. And then I'm going to step back. And so she's secure, she can't move, and wait for further assistance if needed. The last procedure is a hand wrist release. She's going to grab my wrist. I'm going to say, let go. She's not going to do that. I'm going to pretend like I'm going to shake her hand. I'm going to rotate, and then I'm going to put my palm down and bring my arm out and walk away or run, whichever procedure needs to be done. I hope that you've seen that PMAB is a very manageable way of dealing with aggressive patients. There are some other restraints and techniques that you learn, but for today, this is what I've chosen, and I hope you enjoyed this presentation. Thank you.